Hello everybody, I am Ahmed Serwar. I am a third year medical student in the University of Suleymania of Kurdistan, which you probably has never heard of, so let's try and change that. In this video, we're going to be talking about the thyroid hormone, their production and some of their functions. So let's begin by a little review of anatomy. What is thyroid gland? Thyroid gland is basically a single gland that is located in the neck, which is composed of two lobes, the right lobe and the left lobe, that they are connected to each other by a narrow isthmus. Each lobe is pear-shaped, and sometimes on the isthmus we have another lobe that is called a pyramidal lobe, which can be present that look like a pyramid. That was definitely not a pyramid. But basically that's the idea. We have two main lobes, right and left, an isthmus, and sometimes we also have a pyramidal lobe, which does not necessarily have to be always present. So now let's get to our topic. Basically, thyroid gland is composed of two main cells by the names of the follicular cells and parafollicular cells, as you can see in here, in which parafollicular cells are sometimes called C cell. But it is important to keep in mind their distribution of these cells. Basically, follicular cells are forming circles with each other. They are forming what is called follicles, in which inside the follicle we have a space that is called colloid, which is of very great importance for the formation of T3 and T4, the main thyroid hormones. On the other hand, parafollicular cells are distributed or located between these follicles, in which parafollicular cells are responsible for the formation of calcitonin. So, when we are saying thyroid hormones, we mean both T3 and T4, also calcitonin, but mainly we are talking about T3 and T4. Calcitonin is produced by parafollicular cells, that's all you have to know about them, and they are responsible for maintaining calcium balance. What do? They are sending calcium from the blood into the bone, meaning that they are decreasing blood calcium. So, now let's come to the follicular cells and the production of T3 and T4. Before getting into all that, one thing that you need to keep in mind is that T3 and T4 are actually produced inside colloid. They are indeed even stored inside colloid. But when they need to be released into the blood, they are passing via the follicular cells. And the things that are making them are also passing via the follicular cells. It is complicated, but it's very interesting. It's actually also not that complicated, to be honest. So, first step is absorption. What do you mean by absorption? We mean the absorption of iodine. So why on earth do we need iodine? It is in the name, T3 and T4. T3 is triiodothyronine. Triiod, there is iodo in it. And T4 is tetraiodothyronine. So in simple words, T3 has 3 iodines and T4 has 4 iodines in it. That's all. As simple as that. And T4 is also called thyroxine, so just know that just in case. So basically, step 1, we have absorption of iodine, which is I2, in which we get iodine from food, and then it is absorbed in the GIT. Then we have the transportation of that iodine. But before being transported, iodine must become iodide, then it is transported in the blood, and it is going toward the thyroid gland, from our GIT to our thyroid gland, because that's where we need it, isn't it? So, that's the transportation. Step 3 is uptake. Uptake of iodide by the thyroid. But we need this iodide in here. So in order for this iodide to come into the colloid, it must pass through the follicular cells. So like I said, they are working together. It's not independent. We need follicular cells. We need colloid. Alright? So basically the iodide is going to come in here. How does it come in there? With the help of sodium iodide importer, in which it is transported both sodium and iodide into the follicular cell. From there, it is entering the colloid. But we need iodine. We need this one in order to make T3 and T4. We do not have any use of this. This is just for transportation. So what do we have? We have stage 4, which is oxidation. Inside this area, inside the colloid, we have an enzyme called thyroid peroxidase, or TPO, which is converting iodide into iodine, as simple as that. So when it comes in here, it converts this back to iodine into I2, and then this would be stage here. So now let's come to stage 5, which is iodination. What do we mean? The iodine that is in here gonna be iodinating the tyrosine residues of what is called thyroglobulin. Sorry, I didn't write it here, but basically we have thyroglobulin, and it has tyrosine residues on it. And with the help of the thyroid peroxidase, once again, so thyroid peroxidase now have 2 jobs. It will have another job as well. I'm going to talk about it. It will basically be converting thyroglobulin into what is called MIT and DIT, which is monoiodotyrosine and diiodotyrosine. MIT is a thyroglobulin that has a single iodine in it, and DIT is a thyroglobulin that has 2 iodinated tyrosine residues in it. As simple as that. And then we have stage 6, which is coupling. Basically, DIT gonna be either coupled with MIT or coupled with another DIT. If it is coupled with an MIT, it is DIT plus MIT. In here we have 2 iodine. In here we have 1 iodine. In the MIT, it will form 3 iodines in total. Therefore, it is forming T3. But if it is DIT plus DIT, it is having 4 iodine in total and it is forming T4. That's the whole difference between T3 and T4. T3 and T4 are decided here, are made in the stage of coupling. Till here they are all the same, till stage 6. So basically this reaction is also mediated by thyroid peroxidase. So thyroid peroxidase have 3 functions. It's responsible for the oxidation of iodide into iodine, is responsible for the iodination of tyrosine residues of thyroglobulin and forming MIT and DIT. It is also responsible of the coupling of MIT and DIT and forming T3 and T4. So it is very important, basically, that's the whole point. And then we have the release. So basically, before getting into stage 7, thyroid hormone is going to be stored in here, inside the colloid for as much time as we want, till the point that we want them to be released into the blood. Then when we want them to be released into the blood, once again they have to pass via the follicular cell. So what will happen? Now we have thyroglobulins that are containing T3 and T4 because we had the coupling before. So basically, they will come into the follicular cell, endocytocytes called. Inside the follicular cells, they will be proteolyzed. We do not need the thyroglobulin. We need the T3 and T4. So the thyroglobulin going to be proteolyzed, going to be destroyed, and T3, T4 going to be isolated. Then they're going to be released into the blood. But one thing to mention before I forget is that based on production, the thyroid gland is mostly producing T4. We may ask why. I'm just going to explain right now. So basically, when you are releasing them in the blood, they are hormones. They need to be binding to plasma protein. What plasma protein we have? We have thyroxine binding globulin. Thyroxine is in the name. It is mostly binding T4. It has a much greater affinity for T4. That's why the thyroid gland is mostly making T4. It is 10 to 1 based on most sources. So it is making 10 T4 per every T3. So they are going to be binding to thyroxine binding globulin, and they will be transported in the blood, which is once again stage 8. We have transport. They will be in the circulation, they will go to the target tissue and whatnot. But the point is another thing to keep in mind. When we say that thyroxine binding globulin is mostly binding T4, we do not need necessarily it's not binding T3. It's also binding T3, but it has much greater affinity for T4. So basically they will be transported until they are going to a peripheral target tissue in which we need the action of T3 and T4. So what will happen? We have conversion. Conversion of what? Conversion of T4 and T3. Why on earth are we doing that? We just say that we are mostly making T4 so that we can transport it. So why are we now converting them back to T3? Well, the idea is despite the fact T4 is the most transportable thyroid hormone, T3 is the most active thyroid hormone. You do not get as much benefit from T4 that you get from T3. So basically what will happen when they are reaching the peripheral tissue, T4 will be converted back to T3. How does that? T4 will be converted to T3, not converted back to T3, sorry. How does this happen? By an enzyme that's called deiodinase, which is, it has 3 isoforms that is very important to us, D1, D2, and D3. If it is deiodinase 1 and 2, it is converting T4 into T3, which is the active form, and that's what we need. But if it is deiodinase 3, it is converting T4 to what is called reverse T3, which is inactive. We do not need this. This is basically useless. We are just making it for no reason. God knows why we need it. But basically, we do not need it. It's inactive. We don't need it. But it would be converted to T3, and then the T3 going to be entering the cell via specific transporter, From the cell, it is binding to its specific receptors inside the nucleus, which is the action by the way station, and then it is forming receptor hormone complex. From there, it is affecting gene transcription and leading to the activities. So now let's come to some of the basic function. Before that, we need to talk about the secretion, but the basic function of thyroid hormone we're going to come to in a minute. So basically, the secretion of thyroid hormone from the thyroid gland into the blood and all that is maintained by an axis that is called HPT. Hypothalamus, pituitary gland, thyroid gland. This is a negative feedback cycle. So here is the idea. Basically, hypothalamus is going to be secreting TRH, which is thyrotrophin releasing hormone, or TSH releasing hormone. Basically, it will stimulate the pituitary gland to secrete TSH, thyroid stimulating hormone, or thyrotrophin. And the thyrotrophin going to be stimulating thyroid gland to secrete T3 and T4, which, like I said, mostly T4 by the way. So when the concentration of these are increasing in the blood, they will send a negative pathway to head and a negative pathway to head. They tell hypothalamus, stop secreting TRH for the love of God, same for the pituitary. It is enough because you want to maintain it in a particular concentration. So now let's come to the function. The thyroid hormone are known as hormones of energy because they are controlling every energical aspect in our body. It is a little gland in here that's controlling everything. What do they do? So let's start, for example, with metabolism. In the metabolism, thyroid hormones, T3 and T4, which mainly, by the way, it is T3 because, like I said, T3 is the active form. It is stimulating basal metabolic rate by increasing lipid consumption of our tissues, leading to increased BMR. Increased BMR means you are getting skinny, means you are burning fat, means you are using up energy. That's one. Two, what about still in metabolism? What about the temperature? They are inducing thermogenesis. They are increasing heat production. They are maintaining your body's temperature. That's why if someone has increased T3 and T4, known as hyperthyroidism, they are in heat intolerance. They are always hot themselves. So you put them in a warm place, they would be sweating like hell. What about if they are decreased T3, T4? They are cold intolerance. They are always shivering. Another thing, what about glucose, carbohydrate, lipid, protein? What happens to them? Basically, thyroid hormones are stimulating glycogenolysis. They are stimulating glucose absorption, lipolysis, protein synthesis, all the useful things we need. So that's about metabolism. What about cardiovascular? Thyroid hormones are stimulating increased heart rate and contractility. They are positive increased heart rate chronotropy and increased contractility inotropy at the same time. That's why increased thyroid hormone leading to tachycardia. They are also maintaining blood pressure to a large extent. So what about development in the skeletal muscle, in the muscular system? They are basically increasing the development of the skeletal muscle. They are increasing the development of the muscular system. We need them for growth. If you do not have thyroid hormone, you will not grow properly. Doesn't matter whether you have growth hormone or you don't have growth hormone, whether you have IGF, insulin-like growth factor 1 or not. It is as important as they are. Okay, let's not exacerbate the things, but let's not exaggerate it, sorry. But it's very important for growth. So what about nervous system? Thyroid hormones are very important for the development of brain in infants and children. They need thyroid hormones for their brain to develop properly because thyroid hormone is responsible for synaptogenesis. It's responsible for neuronal differentiation, for example. It is, long story short, important, by the way. It's also important for mood. It is controlling our mood. If someone has large amount of thyroid hormones, they are always angry looking. They are always ready to fight. They are always on a temper. And if someone has decreased thyroid hormones, they are depressed. They don't want to do anything. It's just basically leading to depression, as simple as that. So it's involved, for example, in reproduction and fertility. So that's just some of the many of the important function of the thyroid hormone. So thyroid hormone, long story short, is the hormone of energy. It's controlling everything, and maintaining the level of thyroid hormone is very important. Basically, a little guy in hair can make a big difference. So another thing to keep in mind before ending the video is that in order to maintain normal levels of T3 and T4, we need to maintain iodine in our diet. So every hypothyroidism you see does not necessarily mean the patient, for example, thyroid glands are not working properly, or maybe you have problem in hypothalamus and pituitary. Keep it in mind, it can be simply iodine deficiency. Maybe the person is not getting enough iodine, so you just give, I don't know. Is there any iodine supplements? I'm not 100% sure, but if there is, you can just give iodine supplements and get over it. Like I said, I'm just a student yet, so let's not give any false information. We didn't see the iodine supplements, but iodine deficiency can 100% lead to hypothyroidism, but the treatment, not 100% sure. So that's about that, and this is the end of the video. Thank you very much for watching. Please tell us in the comment section what do you like us to talk about in the next videos, any field of medicine you want. Tell us what shall we change about our methods of teaching. Maybe we should move from board to, I don't know, PowerPoint, or maybe the writing is too small, anything. Opinions, criticism, suggestions, we are all open for it. We are new to this. We want to improve. And have a great time and keep studying, guys.